Well, now is the time to pick up the phone if you have a question for Dr. Zorba Paster. The number to call is 608-270-9933, and the phones are wide open, so it's a great day to call if you have a question.
Well, we were talking about the flu and how there are just so many cases right now inundating hospitals. So, Zorba, what's leading to that? Why do we have this big explosion of flu cases?
Well, first of all, this is flu season, and flu season has been different over the last couple of years because we've masked up with COVID. So we really haven't had much of a flu season if you look back for the last couple of years. So first of all, we don't have antibodies to the other flu vaccines, or rather the other flu that was around in the last couple of years. But the real issue is that only about 30 to 35% of the people in Wisconsin have received their flu immunizations, and the best way from getting the flu is to get your flu shot, and it's not too late. You can get your flu shot at so many pharmacies, your doctor's office, and the fact is that's the best way to keep from getting the flu. Tamiflu is a drug that we use after you get the flu, but frankly, it's not as effective as the vaccine, and this year, the vaccine is dynamite. It really, really works. They take a guess at what the flu is going to be like, and the guess the Feds did this year was perfect.
Oh, that's good to hear. COVID, unfortunately, is still with us, and now there are some new variants out there. How much protection do you think we have from the new variants that are emerging?
Well, I think we've got some pretty good protection, but once again, if you're going to get your flu shot, get your COVID shot also. I mean, they're both available at the pharmacy. They're both free of charge. They're both paid for with our federal tax dollars. And the fact is that's the best way to basically stay healthy. But the fact is the present COVID that's around is very, very, very contagious. Now, the good news is that so many of us are immunized. They're not really producing a tremendous spike in hospitalizations. But still, if you're over the age of 65, that is the greatest risk factor, as well as people who have other problems such as autoimmune disease. So get your COVID shot, get your flu shot. That's the best way to treat it.
Well, speaking of flu shot, Sally from Sun Prairie has a question about that topic. Sally, what's your question?
I would like to know if they have determined the efficacy of the present shot that they're giving. Is there enough studies done, or have there been done, so that we know if what we got is going to work?
You bet. And the answer is yes. We know that this particular shot is great this year. So the answer is it's a really good flu vaccine. And so roll up your sleeves and get immunized.
Hold on.
All right, let's go to Alan in Baraboo. Hi, Alan. What's your question?
Hi. I had the flu for about 3 weeks, and the residual after effects that I have a left plugged ear, and I'm wondering what I could do to relieve the pressure on that ear.
Well, sometimes just taking an over-the-counter, a decongestant such as Sudafed may help relieve the pressure. But you can also get Flonase, which is fluticasone nasal spray, over-the-counter, 2 squirts in each nostril once or twice a day. Way in the back of the nostril might just open up your eustachian tube. That's the tube between your nose and your ears. When you blow your nose and you pop your ears, that tube may be inflamed, and a little bit of steroid nasal spray might just do the trick.
Thank you very much.
All right, thank you for calling today.
All right, Charlie from Richland Center, what's your question?
I'm calling about all the variants of the COVID that are out there. I got my COVID shot, the 5th one, about a month ago, and I'm wondering how good a protection I have against these new COVID vaccines.
The answer is pretty good protection. Is it perfect protection? Nothing is perfect when it comes to immunizations, but it's really good. And most people who are fully immunized, when they get COVID, if they get it, don't end up in the hospital, don't end up in the ICU, don't end up, in something serious. Usually people feel pretty ill, but they are not super ill. So the answer is yes. Your immunizations are exactly where you want it to be.
Okay, thank you for calling. Let's go to Tina in Sun Prairie. Tina, we're getting a little tight for time. What's your question?
My question is I got the
third booster?
Booster, yeah, and I got so sick. I was sick for 3 weeks, and I'm scared to get the other one.
Well, that's where you should really call your doctor and talk to them and find out whether or not you were sick from that or from something else, because you don't want to make a decision that's wrong, and it may be still the right decision to get the next booster. So talk to your doc. That's the best answer I can give you.
Well, yeah, and I got immune deficiency disorder too.
So that's really important for you to double check. Super important.
Okay.
All right. Thank you for calling. Thanks, everybody, for all of your calls. We really appreciate it. We're out of time.
Yeah, goes so fast.
It did go so fast. Zorba, have a wonderful holiday. Thank you
Same
so
for
much.
you guys.
Right.
Brady,
Happy holidays.
We have to get you that blazer. That thing is outstanding.
I want that hat. All right. We'll be right back.
We'll be right back.